Well, welcome to everybody. My name is Osmar Eduardo García Pérez. I am a surgeon graduated from the Universidad Pérez Autónoma de Tabasco, and today I'm going to talking about the topic of dihydrotic eczema. We are beginning talking about this disease, and we are starting to define what is. Dihydrotic eczema is a dermatological condition characterized by the appearance of small, fluid-filled blisters on the palms of the hands and the side of the fingers. Sometimes the lower part of the feet is also affected. However, it is more common to find it in the palm of the hands. The lesions or blisters that appear in this eczema may be of variable duration. However, many dermatology books indicate that the average duration is between 2 and 3 weeks. Cause of dihydrotic eczema. The exact cause are unknown. However, the literature indicates that it is more common or generally seen more associated with patients with a history of atopic dermatitis. However, many articles or medical reviews suggest that it may also manifest as hypersensitivity or allergy reaction when contacting certain types of irritants as soap, chlorines, and disinfectants. And here we can see some image about this eczema. It looks very different from every person, so this is why are a lot of image in all the presentation. Now we are going to talk about the risk factors. These are four mainly. The first is stress. This could be caused by the work, the school, or the home itself. Second is exposure to certain metals, corrosive or irritants. The third point is sensitized skin. This is when the patient had some other dermatological pathology before the eczema, and therefore the skin has not fully recovered. And the fourth is atopic dermatitis. Here in the 4 point, with atopic dermatitis, we're talking about any kind of disease with the skins. It doesn't have several complications as such. However, the main discomfort that patient manifest is burning, pruritus, this means itching, and depending on the degree of the eczema, could tear the skin with wounds or sores, and even could impede mobility. This means that the person is not being able to use their hands. However, once eczema occurs for the first time, it could manifest itself in a way constant or regular from months or years. Characteristic of lesions. Well, they occur most often in the side of the fingers and palms of the hands. Sometimes the sole of the feet may also be affected. The blisters are usually small, about the weight of a standard pencil tip, and are grouped in clusters. Here we can see one example of an eczema in the soles of the feet, and well, here we can see eczema in the palm of the hands and some part of the fingers. In more severe cases, small blisters may fuse to form larger blisters. Skin affected by dihydrotic can be painful and cause a lot of itching. Once the blister dry and peel, which happens in about 3 weeks, the underlying skin may be red and tender. Here we can see one example from this that I am talking about, the skin red and tender. Here we can see in some of the palm and the fingers that it is more red. Well, it's recommended to visit the doctor as soon as we begin to notice the appearance of this type of lesions. Because although the eczema is not contagious properly, it can be very easily aggravated to the point of making the affected hands or limbs impossible to move. Prevention. The eczema as such is considered an acute disease. As such, there is no prophylactic or preventive treatment for this disease. However, many literature says about precautionary measures to prevent development of this disease, among which the following are highlighted. Here are four that are also the main. The first is use cleaner or milk detergents. The second is do not have direct contact with irritants as chlorines, metals, and soaps, as we said before. But if we need to have contact with them, we have to be using gloves. And the fourth is keeping the skin hydrated. Treatment. The treatment is usually very varied, and like everything in medicine, especially in dermatology, the treatments have to be individualized. They can range from oral antihistamines to injected corticosteroids. This depends a lot on the degree of the condition. The basic picture for the treatment of the disease always includes oral antihistamine, as loratadine, levetiracetam, etc. Pharmaceutical moisturizing cream. This is dermatological brand without fragrance or color. Avoid direct contact with possible irritants. That means using gloves. And well, in conclusion, why are we talking about the dehydrating of fish in the first place? And this disease is not so common to find it in patients of our entity, that means Tabasco. However, with the beginning of the SARS-CoV-19 pandemic in 2020, there has been a significant increase in patients with this condition. Although there are no studies supported by dermatological institutions or laboratories in which the reason for its increase is explored, the medical community associated with the constant use of antibacterial gel, which usually have a concentration of alcohol bigger than 70%, disinfectants, antiseptics, and home remedies for antiseptics created by the common population under the need for a measure of protection before COVID-19. So this is why I think that it's important to keep the medical community informed about this pathology and to keep us constantly prepared so that we can provide better medical care more timely and effective in the front of emerging disease. Well, this is my presentation. This was my presentation, and thank you for listening. Goodbye.